Hi again, this is Dr. Behbahani from Central Valley Dentistry, and today I'm going to be covering a very important topic, and that is implant failures. And I hope this helps people to avoid costly dental mistakes and errors. So most dentists don't talk about the failures. At the lectures, on the podiums, most people talk about great success, but it is just as important to talk about the failures. Implant dentistry is something that has been around since 1983. Of course, there's research from before that time, but what we know clinically are from 35 to maybe 40 years ago. And over the past 10 years or so, more and more people are getting dental implants, and we get to see more dental complications with those implants. So I'm here to talk about 5 main reasons why implants fail. The first one is metabolic, and that basically refers to what goes on within your body, specifically in patients that have diabetes or osteoporosis or osteopenia. Implant failure is much more prominent because diabetes can have lower and slower healing rates, and implant rejection is not uncommon. So it is important for our patients that are diabetic to have their most recent, within 90 days of their hemoglobin A1C test. You can get that from your physician before you get an implant. And we want to get that hemoglobin H1C level at a level of 7 or below. That would be ideal. And definitely anything at 9 or 10 level is just going to make the surgery much more complex. The second reason for an implant failure, and many doctors may agree or disagree on this issue and have their own thoughts, is basically smoking. Smoking can cause your capillaries and your blood vessel to constrict, and it reduces the amount of blood flow for the implant to what we call osteointegrate, which means that your natural native bone will try to integrate around the implant and kind of creep up around that implant and forming new blood vessels and new bone to generate around the implant and stabilize the implants, titanium implants. So patients that are smokers or have been smokers and they quit can still suffer from an implant failure because the capillary and the blood flow may be reduced. So during the surgeries, we encourage all of our patients and we advise strongly against smoking, just because we want to minimize the risks and maximize ultimately a good result and a successful result for our patients. Another reason for an implant failure is actually unknown. Sometimes we don't know why the body rejects or the implant doesn't take within the bone. In these instances, we sometimes go back and do a revision surgery and attempt again to place the implant. If it's not related to systemic diabetes or osteoporosis or smoking or even mechanical or surgical protocol, sometimes we don't exactly know why. And in these matters, we typically just go back and do a revision surgery and redo that implant surgery again. The fourth reason for implant failure is insufficient bone. Granted, at times we are compromising by doing shorter implants to avoid sinuses or putting skinnier implants within the bone, but in reality, we need to do appropriate course of action. We need to bulk up the bone, we need to do sinus lifts, we need to do gum grafting or tissue grafting to thicken that tissue also around the bone to protect that bone. So in these instances, that can be done before the implant placement or at the time of the implant placement or after the implant placement. So at any point, we have enough opportunity to make sure the implant is embodied with sufficient amount of bone, so that way the implant is not rejected or we don't have loss of bone around the implant threads. Same issue with gum grafting or tissue grafting. We need to have enough keratinized, thick tissue around the implants to make sure bacteria don't infiltrate and also protects the bone underneath of it. The fifth reason for an implant failure is surgical error, complications, cross-contamination, and also the expertise level of the clinician or the provider. There are different material in our arsenal that we want to utilize, and we can't use the same technique and same protocol for all patients and expect great results. So sometimes we need to use different techniques and different material in different cases, but being able to have a CT scan to assess the bone, being able to use different modalities of bone grafting and bone augmentation. On top of that, having a nice tissue transplant or tissue grafting to guarantee the site is going to remain nicely closed and heal well. Would basically enhance that implant longevity. Implants have 90+% of success rate, so it's a unique procedure that is being done. It just has to be done accurately with the right angulation and right material to be used. Last but not least, I want to talk about what happens when we lose a dental implant. I definitely encourage patients to talk with their doctors about what happens in the case of an implant failure. And typically in our practice, within the first 3 to 6 weeks, we will give it ample opportunity to integrate and let it heal. But if we notice that there is an abscess or an infection or bone loss, a foul taste or smell, tissue swelling, sometimes accompanied by a significant amount of pain for the patients, within that first 3 weeks, between 3 to 6 weeks, we will explant and remove the implant, clean the area, regraft, and allow that area to heal and enter for a revision implant surgery in about 4 months after that. One of the most important things is when you get your implant surgery is that we avoid any sort of trauma or movements or eating on that side, and that's something that post-operatively we need to follow a strict appointment depending on the invasiveness of your procedure. If you've had bone grafting and tissue grafting, if you've had all of the things done, you want to make sure that nothing is disturbing the site. Your tongue is not playing with the sutures, and that you're not eating on the site, and that you're not exploring with the tongue what's going on. So any sort of a stretch or movements can cause the graft to dislodge and cause the graft to get infected at that point, because new blood vessels don't form and new capillaries of blood don't travel to integrate within the grafted area. So it is number one most important thing is to stay away from the site and make sure no mechanical trauma is going to move or dislodge the graft. And that's something that you need to talk to with your doctors as far as your post-op and follow and strict post-operative instructions. This is Dr. Behbahani again, and I hope you find this video very helpful. Thank you very much.